Hey everybody, Dr. Mark here, and I am super excited to be with Dr. Avrum from Queens, New York, and graduated from New York Chiropractic College, been in practice for 48 years, and we are going to be discussing tonight defining chiropractic in the current era. So thank you for joining us tonight, Dr. Avrum. Thank you for taking the time. And so we'll start with the question I always ask chiropractors. How do you define chiropractic in your office?
Chiropractic is a philosophy, science, and art, and it's a system that um, goes for things that are natural. It's a system of it's a system of going after the subluxation, and specifically, and it's how we do it in the office. And when I
Okay.
talk to the patients, it's specific about subluxation.
Okay, and I respect that. Tonight, we're going to be talking specifically to chiropractors in interprofessional discussion. So, intraprofessional. So we're going to be talking in the terms of chiropractic. Now, do you adhere to Stevenson's definition? It sounded like you were alluding to Stevenson's. Is that correct?
Yes, correct.
Okay, I like the modification you made, but if we're looking at Stevenson's, the definition in the 1927 textbook of R.W. Stevenson is chiropractic is a philosophy, science, and art of things natural, a system of adjusting the segments of the spinal column by hand only for the correction of the cause of disease. Correct?
Yeah, correct.
Okay. Can I walk you through this and ask you questions piece by piece? And whatever answer you have is fine because I think everybody must read Stevenson. I think it's a must read, and I also think it's a must read to read Claude Lessard's blue books of the chiropractic textbook of 2027, 100 years later. So when first we must take to consideration there is no mention of vertebral subluxations in the definition. He does use adjustment that is specific to chiropractic, but vertebral subluxations is not in there, so that's a first red flag. Second, how do you define of things natural?
Well, things natural as far as the body's own mechanism for um, physiologically getting well and continuing to maintain the health of the body, all totally in a natural way. So that's basically how I look at it. And
So,
when he talks about the cause of disease, he's
oh no,
referring
no,
to
no, hold
subluxation.
up, hold up, hold up. No, don't, no, no, don't. We're going to get there. Let's
Oh,
go one step
okay.
at a time, Doc. I love the enthusiasm. So,
Okay.
what I would say, my argument would be when we're getting sick people well, we have
Yeah.
now stepped into the realm of medicine, and that's physical medicine, which was the biggest mistake that all three of DD, BJ, and DD made, or RW made. They never left the realm of physical medicine. So, what I would say, our first professional agreement would be that if we're in a profession of getting sick people well, which the majority of chiropractic is, that is physical medicine, and that's in direct competition with medicine and should be held to a medical standard. So, and we can disagree on that. Logically, it's a hard to argue case.
Well, when
So,
in the definition, when they talk about by hand only, weren't they kind of referring?
hold up, we're going to get there, Doc. We're going to get
Okay.
there. All right. So, when we look at a philosophy, science, and art of things natural, a system of adjusting the segments
Segment
of the
system.
spinal column, which he's close there. That's the best part, I think, besides philosophy, science, and art, that there is a system, there is a repeatable science in there, but he does not make any clarity in regards to vertebral subluxations, which is the essence of chiropractic. Okay. So now let's go to that next step that you bring up. By hand only. Does that mean that the adjustment can only occur to the vertebral subluxation by hand only?
He was referring to that when they actually wrote that definition. I think they were trying to say it wasn't with surgical instruments. It wasn't with those kind of instruments that he was talking about it then. I mean, now, we're using some instruments that help to adjust, whether it's the atlas or other aspects of the spine, instead of using the hand, but basically it's by hand only, which was referring to, I felt the difference between medicine and chiropractic.
Okay. Is it possible that it could need some clarity?
I'm sure there's a lot of need for clarity down the road, but I think
Correct.
that think what, well, we'll get to it. I have
Okay,
some
fine,
thoughts on that.
fine. Okay. And then for the correction of the cause of disease, I do understand the term disease in chiropractic means the body not at ease. Although I will say this, unfortunately, BJ Palmer used disease and disease interchangeably later on in his green books, along with making chiropractic a theosophy of universal intelligence being God and innate intelligence being the soul. So and once again, the matriarchs and patriarchs of chiropractic deserve our appreciation and our commitment to logically clarifying things in chiropractic. So now we have two professions. One that gets sick people well, which of course is going to add therapies and things of that nature. And then a very small fraction that says vertebral subluxations in and of themselves are detrimental to the expression of life. Could I give you the definition that I use in my office?
Go ahead. Let me hear.
Okay. And this definition is based on the logical deductive principles of the 33 principles chiropractic basic science. Yes, directly out of Stevenson's with certain clarity, because like you said, this being written in 1927, 100 years later, not only do we know more, words change, words evolve. So when we look at chiropractic, the definition that I use, which happens to be the definition in the non-therapeutic model, is chiropractic is the analysis and the facilitation of the adjustment of vertebral subluxations because they, in and of themselves, are detrimental to the expression of innate impulses and trophic impulses. Chiropractic is all education toward this objective, and chiropractic is nothing else.
When you talk about medicine, that the first definition or the first part of the definition um, didn't really separate medicine to you. That definition doesn't separate, it's the separation of medicine and chiropractic. To me, the Stevenson definition, with a vertebra that has lost its juxtaposition, to me, is still valid,
Well,
including
now
an opening.
you're talking about something different now. We got to stick to the topic, Doc. Now you're talking about the definition of a vertebral subluxation, and we can go into that because Stevenson's definition is still 95% congruent. What we're looking at is not only the entity that the chiropractor exclusively focuses on, but the objective of that. So in the definition where you gave for your office, you did add subluxation. I would say, well, for more clarity, vertebral subluxation, but that was a good thing. But saying we get sick people well, that is the definition of medicine. And that's what medicine does, gets people well, keeps well from getting sick, prevents people from being sick. So that definition is a medical objective. And in the non-therapeutic model, we're saying that the vertebral subluxation, which, yes, Stevenson's definition is the condition of a vertebra that's lost its proper juxtaposition with the one above, the one below of both, to an extent less than a luxation, which impinges nerves and interferes with the transmission of mental impulse. We modify the term mental impulse because mental means it's located in the brain, and now we've left the brain if a vertebral subluxation in most cases, but can a vertebral subluxation affect brain tissue too? Yes, of course. The issue is this: that now it's a trophic impulse and it's a innate impulse. It's traveling down the nerve system in some way around the vertebrae that can cause some sort of interference with the different theories, because there's also brain and spinal cord theory as well. So the only modification there would be the metaphysical component of the innate impulse and the trophic impulse. But yes, Stevenson's definition, 100%. The issue that we have, Doc, is that the objective that, yes, you can have an exclusive practice adjusting vertebral subluxations. If your objective is getting sick people well, that is a medical model objective, and therefore you need to be held to a medical criteria and standard.
I find that interesting in the way you're describing that. Let me ask you a question. In your practice,
Yes.
when you evaluate a patient, where is palpation?
Say that again.
Where where is palpation when you evaluate a patient? Is it the only evaluation that you have, or
Well,
is it part of it?
the analysis that I use, so I don't use the term evaluation in my office. We use analysis. And the
Okay.
analysis that I happen to use, Doc, is advanced muscle palpation. I'm sure you're aware that we feel the muscles bilaterally. And what we're doing is seeing what muscles are working to try to, one, it indicates the presence of a vertebral subluxation and the vector that the innate law is trying to make the adjustment. So
Hmm.
that would be our analysis. And we do so as safely as possible. We have a consultation, of course, and we educate on how chiropractic is a very necessary habit for a fuller expression of life, and that everybody has vertebral subluxations. We're going to safely analyze you for that exclusive entity and help your body make the adjustment. That the chiropractor does not make the adjustment, because the chiropractor does not know innate normal. We simply are making an educative force, universal educative force, so the innate law can convert it to an innate force, bringing the vertebra that's subluxated back to its innate normal position. And to answer your question, yes, my that I begin with on the first visit, and I do every visit after that, would be the advanced muscle palpation analysis.
All right. There's two things I would just want to add to that, or
Okay.
state. Number one, we found out through our study and research in the Pierce results system, which is I'm part of, and the moving X-ray, the DDR, we found out that when we are palpating, we have fixations, misalignments, compensations, pathology, and the true subluxation. Question is, when you palpate, can you tell the difference between any of the five? That's number one. Number two, there's a theory in health called the Gibson um, theory, and it has to do with muscle reaction to the body's inflammation or pressure that it imposes. So, in other words, if the lumbar is pulling the spine to the right, that may be a compensation. And then when you feel that, can you tell if that's a compensation? Because I have found, and there's a lot of chiropractors who, I have consulted with, when after the second or third adjustment, when they are adjusting over and over again the same area, all of a sudden the patient has some kind of a reaction, and it could take about 8 weeks to get them out of it. If they are adjusting the subluxation and not compensation, they probably won't get that kind of reaction. So the aspect of the the subluxation being only about muscle when there's a nerve component, I think that there's
No,
more to it.
that's not what I'm saying. That is definitely not what I'm saying. I understand Pierce. Pierce never left the medical model. I think it's a bit of nonsense to say that compensation and fixation. We as chiropractors are taught one thing: vertebral subluxations. I'm not looking at the muscles as an effect of the vertebral subluxation. No, not at all. Every analysis has one thing in common, Doc. one thing in common. What is the innate law within this matter trying to do to restore that vertebral subluxation back to its innate normal position? We do not know what innate normal is. So, and I understand this. This is, you're coming from a bit of a medical thinking that we're not looking, Stevenson talks, I think it's number 17, cause and effect. For every cause, there is an effect. For every effect, there is a cause. The musculature, when we look at, say, research, the highest density of proprioceptive fibers is in the zygapophyseal joints of the vertebrae. And there's a direct reflex arc from that area to the brain, back to the paraspinal muscles that activates the muscular system. That's the system of motion that's designed to move things. So the innate law, this is the theory behind this particular technique. The innate law is using the muscles, the paraspinal muscles, to try to adjust that bone back where it belongs. Now, by definition, the innate law has lost some control over this matter. The vertebral subluxation means there's less of an expression of this innate law. And the chiropractor, the best the chiropractor can do is to utilize an universal, educatedly placed force so that it's converted to an innate force, therefore adjusting that subluxated vertebra back to its innate normal position that nobody knows, that no x-ray will ever tell you. And so this is a difference in thinking. Pierce never left getting sick people well. He was in the medical model. And
You ever
we're,
have you ever sat in Pierce's um
yes, I
seminars?
have. I have, yes. Yes, when I was at school, I did, and it was right when he was working with Stillwagon, and then when he went out back on his own, and then he was working with Pettibon. All of the thinking there was medical, trying to create a change in the spine where we think the spine should be. That is a medical outcome. In the non-therapeutic model, we do not know what innate normal is. So when we look at a technique, what we're looking at is the theory and the congruency with chiropractic principles. The whole idea about compensation and fixation, maybe a vertebra has ambient motion, maybe it's locked up, or maybe it's moving too much. Any one of these theories can be true. So with the advanced muscle palpation, in either circumstance, the innate law is using this system specifically to try to make the adjustment. And that's where the philosophy and the theory come together in that applied science of that technique.
I don't know if I agree with that, and I'll tell you why.
That's
Over
okay.
the
Go ahead.
over the over the years, I've received patients who have had sciatic pain for 3 years, 4 years, 5 years, and they've been to medical doctors and they've been to chiropractors. And when we evaluate or analyze the spine, we see like for example, in the motion X-ray, we now see where it's locked. And when we adjust it and unlock it, we can unlock it in a matter of minutes and get
And
it and
what's
get it
what's your objective? When you talk about your patients coming in with sciatica, what's your objective?
objective. The objective is not the pain. The objective is to get the digital thermography to show a normalcy. In other words, that the flow of nerve in the spine is more normalized, and we can tell what is normal, what's not. And then
Well,
we
I, okay.
reevaluate that with the moving X-ray, and we also have now something called a wave analysis where we are able to tap each vertebra and see which ones are locked and which ones aren't. So
So
we're
then,
starting to
in your
see the definition of the subluxation may have to change as far as a locking that goes on. It may not necessarily be out of the juxtaposition, but it is locked on motion.
well, I
And
mean,
we're
I
finding
think
that the muscles we're finding out also that the muscles are responding because they seem to be the body's way of not only compensating but changing accordingly in order for it to be able to adapt to either a subluxation or adapt back to normal. And we're seeing that,
That's,
we're seeing
I
that.
don't, I don't,
And then
that
the
doesn't
other
make a lot of
aspect is
sense.
that when we get somebody well, for example, let's say,
Okay, that's a medical objective. See, now here's the thing. The vast majority of what you're talking about, Doc, is a medical objective. When you're talking about these fixations and we're looking to you're looking at the muscles as a pathology or a compensation and then getting sick people well, these are medical objectives. So
do you
you're in the
remember
realm of,
in one of the green books, um, Palmer did talk about a, taking care of a chiropractor who came back, I think, from the Korean War with he had cancer of the liver.
yeah, the vast
And
majority of green books are physical medicine. BJ never left getting sick people well. You
well,
know,
then
BJ wrote.
if you know his 39th volume indicated a lot of change, but most of it was his summary of his 60 years of research.
Well, he didn't do 60 years of research. BJ
Oh yeah.
said when BJ had the research clinic from 1935 to 1951, he said they did 3,500 hours, man hours of research, and that is 4 years. That is 4 years of in regards to direct hours of research. Now we have to remember that a lot of that research never really followed the standard that we have today, and a lot of that was lost and it was found in an elevator shaft. Or that was always the rumors. So when you look at, say, volume 18, which is the only book BJ recommended to read 3 times, it is based on physical medicine. There are 3,500 conditions in the back of the book, or 1,500, that went away under BJ's care. And BJ did amazing things. So,
I didn't say number 18. I said number 39,
you
and
said
it was his
39. I know you didn't,
our
but hear
masterpiece.
me out. Hear me out. I said that was the only book he said to read 3 times. When you're talking, are
Mhm.
you talking Our Masterpiece? Is that 39, Our Masterpiece? Yes.
Yes, it
And
is.
that was the argument. Did BJ go back to faux spine? BJ talks about BJ's Utopia. That may have been the last book he wrote. Sometimes they're out of chronological order before he died, which he died in 1961. He
Yeah.
never left getting sick people well. He came close when he was defending chiropractors from going to jail when chiropractors were being arrested for practicing medicine without a license. And he also came close in BJ's Utopia. But BJ never left getting sick people well. He stayed in the medical model and had massive issues with medicine, and they fought back and forth because BJ was in the medical model. It wasn't until Reggie Gold in the late 50s, early 60s, because BJ was still teaching when Reggie Gold and Sid Williams were there. Reggie was the first to really be adamant and say, not everybody gets well when vertebral subluxations are adjusted, but everybody lives better and functions better when vertebral subluxations have been adjusted. And that is the most reasonable and honest thing we can say in chiropractic, because not everybody does get well. Not every deaf person can hear again. Not every blind person can see again. And there's more than one thing that can go wrong with the body. I'll even say there's more than one thing that can interfere with the expression of innate law. We as chiropractors exclusively deal with vertebral subluxations. And if we want the world to be checked every week for vertebral subluxations, it is not going to be through getting sick people well, because that is a medical objective. It is going to stand alone on the truth that vertebral subluxations are always bad for every human being and everybody has them. And the adjustment is always powerful because life is powerful. And having a fuller expression of life benefits the world no matter how people feel. The vast majority of what goes on in the body physiologically, we don't know about. We have no idea what innate normal is. In chiropractic, there is no baseline. There is simply innate normal, that you live closer to innate normal when vertebral subluxations are adjusted. And the idea of every single analysis has the one thing in common, Doc, that analysis is trying to figure out what the innate law is doing to adjust that vertebral subluxation back to innate normal.
So when you adjust the subluxation, how do you know you
I
got it?
don't. I don't adjust, the body does. So what we do is we feel the muscles around the spine, and we feel the muscles. And when you have a working muscle on one side, that this tiny paraspinal muscle, whether it's the superior, inferior obliques, the rectus capitis posticus major, the scalene muscles, the multifidi, the longissimus thoracis, the glute maximus, the piriformis, that these muscles are working on a unilateral side to try to adjust that bone back into its innate normal position. After the facilitation, we then reanalyze, checking the same muscles that we did before to see that they have been reduced and that vertebral subluxation has now been restored back to its innate normal position.
So if a patient has stage 4 cancer and they have no symptoms, I've had several patients like that who've come
Okay,
in
this is a
with
medical
stage,
example.
huh? No, what I'm
This is
saying
a
is,
medical
th-
example. Go ahead.
you're saying that there's no sublux, you don't feel the effects of the subluxation. These patients came in pain free. They came in not feeling anything.
Great.
You
Awesome.
know, it was great. Yeah, of
Yeah, can you predict that for every single person who has cancer?
course not. Who
No,
can?
you can't. So the
But
idea
the
is,
idea, but the idea, for example, and I just came back from heart failure, and I had 4 blocked arteries, and I had triple bypass, and I tried to make sense of this over the summer myself, and I realized that I've had 4 injuries, 4 car accidents, where I've created damage at C7, T1, T2, T3. And I've been adjusted upper cervical. I've been adjusted full spine. I've been adjusted in all different types of ways. Tom Whitehorn was my philosophy teacher. He was upper cervical specific, and we had talked about this, ad nauseum. And in fact, when I used to go to his house to talk about philosophy, my friend Donnie, Dr. Donnie Epstein, was in my carpool. We used to drive together. We were pretty close friends. So we tried to learn the understanding of, he said, and it was very interesting, when the subluxation is always on the left, it's always on the left. I've seen in the last number of years since I've had the moving X-ray, it's like I've seen changes in atlases that are not just always on the left. I've seen them on the right too, and I have proof of it. I can see it. Yes, maybe some of it can be thought of medical style. We have to have some kind of basis to be able to know whether we got the subluxation or not. Otherwise, our philosophy of what we profess is that we correct subluxation unless we have some kind of basis to show that we corrected a subluxation. I
yeah,
have
yeah,
many
and
I
that's
have
what
many
analysis.
spines. I have many
That's what.
spines where I have seen in my analysis, let's say a C1, C4, C6 were locked, and then when I reevaluated them, one was locked, the other two aren't locked anymore,
Yeah,
and
but
the spine
that's
changed.
not a vertebral subluxation. That's not a vertebral subluxation. So locked is not a what we deal with as chiropractors. I mean, and
But
here's
it
the
had,
thing, Doc.
but it had a thermography um, pattern
Okay.
also. It
Mhm.
had in the wave analysis, it showed us that it was locked at those areas. I
That's not a
mean,
subluxation. That's not a vertebral subluxation.
that's
Chiropractors work
your, I
with
mean, that's your
vertebral subluxation.
definition. Yeah.
We just agreed on Stevenson's definition. We
Yeah,
just
but
agreed on it.
there's, there's a, in Stevenson's definition is including an opening. It's impinging on the nerves. It's less than a luxation. It is,
Stevenson's
and
definition is a condition of a vertebra that's lost its proper juxtaposition with the one above, the one
one
below,
above
or
and
both to an extent less than a luxation, which impinges nerves and interferes with the transmission of mental impulse. And really close. So here's the thing, Doc, and we're going to wrap this up.
mhm.
Chiropractic has to be very succinct, and every analysis has to be congruent with the 33 principles of the basic science of chiropractic. Now, when we are within the realm of chiropractic, we're not in the realm of medicine. We're not in the realm of getting sick people well. We're in the realm of analyzing and facilitating the adjustment of vertebral subluxations for a fuller expression of the innate law. In our understanding, we further understand these principles from 1927. So yes, they are going to change, and the definitions of words evolve constantly. So we can disagree on a lot of the analysis, and that's fine. We can look at different types of instrumentation, from photography to the infrared to the thermocouples, and there's theories on what it is measuring bilaterally. It could be measuring heat from a nerve, heat from capillaries, heat from muscles that are working to try to pull the bone back in place. So there's a lot of potential correlation. In the end, we have to be very clear and very specific about what we do as chiropractors if
If we're
we're
not
going to
specific,
reach the world.
I totally agree. Specific is a
Absolutely.
key.
Absolutely.
And
So
you
when
know
we
what?
say we're getting
In
sick people
volume
well,
39, Palmer did talk about the difference between constants and
and
variables.
variables, yes,
And he
absolutely.
talked about the infrared. He even mentioned on page 17 about X-ray could be moving at some time in the future. That book was published in 1961, not 1924. So
Well, our
when you talk about
masterpiece, you know.
if you talk about evolve, he evolved. He evolved.
Of course he evolved. Of
And his
course he
students
evolved. But
dropped
he
the
did something in 1961. He died. So he's not evolving anymore. And he never left getting sick people well. You saw that with his Sacred Trust letter. So the thing is this, BJ constantly evolved, Doc. There's no question. He evolved massively in 1923 when he and Dr. Evans came up with the neurocalorimeter leading into the neurocalograph. He evolved
right.
again in 1930 when he went to upper cervical on the knee chest. He evolved again in 1935 when he went to the side posture. He evolved again when he got together with J. Clay Thompson and went to the drop headpiece on the side posture. So he was always evolving. There is no question about it. Where his thinking that was limited, I mean, he died. Innate law doesn't reside in the brain the way he thought it resides in the whole body, you know? And we moved away from putting religion in chiropractic. Universal law is not God. Innate law is not the soul. So yes, BJ constantly evolved, but there were areas that he never left that were 100% medical. And when we're looking at our masterpiece that was published the same year he died, we also have Palmer's Law of Life. We have Complex Clarify, Up from Below the Bottom, the Fellow Within. So yes, I mean, 44 volumes. Some of them repeat. Not all were written by BJ. And so he definitely evolved, but he died in 61. So we still have to keep evolving. We owe it to him to read all those books. And we also owe it to Joe Strauss to read his books and his commentary on the Blue Books and Claude Lesage. So,
and Reggie too.
well, yeah, but Reggie didn't write a lot. Reggie wrote his thesis, which was the principle number 4 that the chiropractics, the triune of life, which is absolutely fantastic. And he wrote the third paradigm. Those are the only 2 things Reggie wrote. And the third paradigm did not hold up to the test of time the way his thesis did of the triune of life. And you can modify the triune of life just a tad bit, and it holds true perfectly to today. So yeah, so as far as evolution and all these things, I think we agree on a lot of things. Some of our terminology I would disagree with, but the thing is,
Just one
bro,
more thing. When I was talking about the chiropractor that had cancer that was in the Palmer Clinic, he got adjusted once, and Palmer was just watching him for about 60 days, and then the cancer went away.
mhm,
Now, at that point, if Palmer had said if he adjusted him and threw him out of adjustment, the cancer
that's
might have
not
got
that's
worse.
not accurate. That's not philosophically accurate. You can't overadjust. You can't adjust someone out of place. An adjustment's an absolute term. Either an adjustment has happened.
We have X-rays that showed that people were over adjusting
That's
following
not accurate.
Pierce's work.
That's not an accurate term. That's not, you do not get over adjusted. You either have an adjustment or you don't. Either a vertebra is subluxated and it's adjusted back to its innate normal position, or the adjustment did not happen. And these are the terms we got to be very clear about. And if an
Oh, I
adjustment
agree.
doesn't happen, it doesn't happen, but it's not over adjusted. Nobody's over adjusted. If a vertebral subluxation exists, it requires the adjustment back to its innate normal position that can only happen by an innate force. The best a chiropractor can do is be a part of that. A chiropractor does not put the bone back where it belongs because we don't know where it belongs. That's the job of the
So
innate
if
law.
so if the bone did go back by itself or by innate intelligence, and then the chiropractor just kept on adjusting the same area,
He's not
what
a, she's
happens?
not a, whoever, they're not adjust. That's not an adjustment.
Right.
If it's not back to its innate
Correct.
normal position and adjustment wasn't given, that's why we have our analysis doc. And every chiropractor should have a very sound analysis to determine this.
That's right. I
And
agree.
even if this guy's cancer didn't go away, they're still better off vertebral subluxation. Every human is. And
I
that would
have
be the,
found,
yeah.
I have found that there are times when I will just C1 or C4 or C5, and the patient had sciatica, and they were saying to me, "Aren't you adjusting my sciatica?" And I said, "We're not adjusting pain, we're adjusting the subluxation." And I explained that to them.
Yeah, because
And
regardless,
when we see the thermography improve, and we re-X-ray and we see that it's improving, the hands off and let Pierce used to say, keep your grimy mitts off the area that you have adjusted and has got adjusted. Leave it alone. It knows what to do from there.
well, we have to remember that we don't know what innate normal is. We don't know what innate normal looks like on an X-ray. If we see changes on an X-ray, we don't know if that's innate normal or not. So that's another thing we could debate later on, Doc.
Mhm.
But you know, our
It's
terminology is
interesting.
a little bit different. Yeah, it is interesting, and these are wonderful conversations that we can
Do
continue
you
to
do you
pursue.
do you follow the network chiropractic?
No, no.
No.
Every time it's been explained to me, I think it's awesome. I don't see how it fits in chiropractic, but it could be better than chiropractic. So no, I don't follow it. I've tried to have it explained to me, and in every case, it's been, well, that doesn't sound like it's chiropractic. I've heard people compare it to energy work and all this stuff, and it sounds awesome. Don't get me wrong,
Mhm.
but chiropractic specifically and exclusively is the analysis and the facilitation of the adjustment of vertebral subluxations for a fuller expression of innate and trophic impulses. Chiropractic is all education toward this objective. Chiropractic is nothing else. It's never been explained to me that it fits in that definition. And the thing is this, Doc, chiropractic isn't the only thing people need. A vertebral subluxation is not the only thing that can go wrong with people. So I would say
Right.
that maybe it doesn't fit into chiropractic. At least I've never been explained in a way that makes that puts it in that category, but it could be better than chiropractic.
Could be. I mean,
Could be.
you, nutrition is important.
It is
Exercise is important. Yeah.
100%. Yes. And so is
Yeah.
breathing and so is rest. None
I
of those
agree.
things are
I
chiropractic, but
agree.
they're very important.
Yes.
Yeah. So
I
we
agree with
know
you.
our lane. Now, look, Doc, it's been a pleasure and I appreciate you and I appreciate your 48 years in this beautiful profession. You keep
Thank
rocking
you.
because I know you're still practicing like a rock
Yes.
star.
Thank you.
Very
As
impressive.
as Rocky Balboa says, I still got stuff left in the belly.
You still got fire left in the belly. That's exactly
Right.
right, Avrum.
Yeah.
And I look forward to you seeing you on social media. I'll get this posted and tag you in it. And thank you for taking the time. You have a great night, buddy.
Thank you. You too. Thank you.
Thanks,
Thanks for
bud.
the
Bye bye.
opportunity. Bye now.
You're welcome. You're welcome, Avrum. Bye bye.